How to manage feeding difficulties in CF infants. Feeding a baby with cystic fibrosis can sometimes feel like a puzzle, but with the right approach, you can help your little one grow strong and healthy. Infants with cystic fibrosis often have trouble absorbing nutrients because their pancreas doesn't produce enough digestive enzymes. This can lead to poor weight gain and slower growth, so managing their nutrition carefully is key. Breastfeeding is highly encouraged because breast milk offers excellent nutrition and immune support. If breastfeeding isn't possible or needs to be supplemented, standard infant formulas are recommended. The care team will closely monitor how much your baby is eating to make sure they're getting enough. Most infants with cystic fibrosis need pancreatic enzyme replacement therapy, which involves giving enzymes with each feeding to help digest food properly. The amount of enzymes is adjusted based on tests like stool elastase and the baby's growth, and your healthcare team will guide you on this. Because these infants burn more calories and lose nutrients more quickly, they need a high-calorie, high-protein, and high-fat diet. Feeding should be frequent, often every 3 hours if your baby is under 4 months old. If your baby isn't gaining enough weight, increasing the caloric density of their milk or formula can help. This can be done by adding calorie boosters like infant formula powder or healthy fats such as butter or oil. Starting around 4 to 6 months, you can introduce solid foods. Begin with iron-fortified cereals made with breast milk or formula to boost calorie intake. Gradually add pureed vegetables, fruits, and meats, introducing one new food every 3 to 4 days to check for allergies or intolerance. Adding healthy fats like butter or margarine to foods can also help increase calories. Regular growth checks every 2 to 4 weeks are essential to catch feeding issues early. The goal is for your baby to grow at or above the 50th percentile. Your healthcare team will review feeding patterns, stool habits, and sleep, providing ongoing support from dietitians and other specialists. To boost calories without increasing volume, you can add ingredients like full cream milk powder, cream cheese, grated cheese, or avocado to foods and drinks. Once your baby is older, smoothies and milkshakes can be fortified with extra calories too. Feeding difficulties such as poor appetite, fatigue during feeding, or stomach discomfort can be managed by creating a calm, comfortable environment. Offering smaller, more frequent feedings can help prevent fatigue. If oral motor skills are delayed, feeding aids or techniques recommended by therapists can make a difference. Always communicate with your CF care team if you notice persistent feeding problems so they can adjust enzyme doses or feeding plans accordingly. Because vitamin deficiencies are common in cystic fibrosis, daily multivitamins tailored for CF are recommended. These usually contain vitamins D, E, and K, which are fat-soluble and often need supplementation. The typical dose is about 1 milliliter per day, sometimes divided into 2 doses. Remember, every infant is unique, and managing feeding difficulties requires personalized care. Your multidisciplinary CF care team, including doctors, dietitians, and therapists, will work with you to develop a plan suited to your baby's needs. Ongoing education and support are vital as your child grows, helping you adapt feeding strategies over time. In summary, ensuring your infant with cystic fibrosis receives a high-calorie, nutrient-rich diet with enzyme support, regular growth monitoring, and early introduction of calorie-boosting solids can make a big difference. Always consult your healthcare providers for tailored advice, and remember that with careful management, your baby can thrive and reach important developmental milestones.